Welcome to this episode of Evidence of Greatness. This time I'm going to look at a relatively new study that was done about solution-focused brief therapy, but it was done in a really interesting context. So we're going to look at this article that looks at addressing depression and comorbid health conditions through solution-focused brief therapy in an integrated care setting. And then this was obviously a randomized controlled trial. So you can see there the authors of this study. Now, one of the things I want to say right off the top about this study is that it was done really recently in March of 2024. And for that reason, it hasn't gone through the peer review process. And so these findings are preliminary findings, but I think they're compelling enough that we should consider them and look at this context. So here's a little bit of background. Recent studies have found that among patients with diabetes, so remember this is a study about depression and comorbid or health disorders. So are there mental health and physical health disorders that exist at the same time? So among patients who have diabetes, 69% of them reported having anxiety, 65% of them reported having depression, 62 of them had a fear of low blood glucose, and about half of them reported not ever having mental health discussions with their medical care teams. And so this study comes along in an integrated care environment, which means that the physical health, the doctors, the physicians, the nurses, physicians' assistants, those kinds of things are working in tandem with mental health professionals. So in the recent research, about 10% of patients with mental health disorders received treatment from a mental health specialist. So that's very few. Many of them are being treated by primary care physicians or things like that. And predominantly, that would likely result in them being prescribed medication for their mental health disorders. In addition to that, 57% of patients receive no treatment for medical or for mental health disorders. 33% were treated again by their primary care physician. But these providers oftentimes reported having a lack of time or a lack of expertise to actually address the mental health concerns. So within integrated care teams, when there's a mental health specialist, at the beginning of relationships, that tends to go better. And this is beginning to form in integrated health teams. They're starting to include mental health professionals. So this study will look at solution-focused brief therapy with a primary care behavioral health model. And what this means is in primary care, at least here in the United States, you have very short durations of visits, right? They're trying to get through as many people as they possibly can to help as many people as they can. And so this model really is saying, can we do solution-focused brief therapy in particularly short times, 20 to 30 minutes, and oftentimes with only having 1 to 3 sessions. So there's kind of layers of investigation happening here. One, in this primary care behavioral health model, does it work? Two, with comorbid disorders, does that work? And so we want to look at what impact does solution-focused brief therapy have? So they did, for this study, block randomization. So they did a power analysis to see how many participants they needed in order to get statistical results. And it was determined that they needed about 40. They ended up doubling that number just to be sure. And so when the study began, they had blocks of 20. They would get about 20 participants in. Then they would randomize those 20 into the two groups, the treatment as usual group and the solution-focused group. And then they would wait to build up until the next 20 were in place. And then they randomized those. So it's not a complete randomization, but they did it in the randomization in blocks. So they divided again into two groups, the treatment as usual group. They received visits from their primary care physician. They received medication for their mental health or for their health conditions. And then they used a problem-focused psychological assessment, a typical assessment to say, do you have depression? Do you have anxiety? And then they didn't receive any behavioral intervention. So it was really just treatment from their primary care physician. In the solution focus group, they received treatment from a licensed clinical social worker who used a treatment manual, a solution focused brief therapy treatment manual. But it's important to note that the treatment manual was adapted for this primary care model that they're trying to implement. And so they did a baseline screening. Then they received 20 to 30 minutes of individual visits with this social worker, the interventionist. And then they also completed measure of a solution-focused measure. And the fidelity was also used to say, does the provider stick really closely to the solution-focused approach? So that's a real strength for the development of this methodology. So then they collected data both at baseline, so before anyone got any treatment, and then also at the end of 3 weeks worth of intervention, whether that was with the primary care physician or the primary care physician and the behavioral health specialist. So when they did outcomes, they were looking at symptoms of depression, in which they measured through the PHQ-9. They were also looking for health outcomes. Does it change blood pressure, BMI, or HbA1c? So those are levels that are important for diabetes. And then as secondary outcomes, they were looking for, does it change the symptoms of anxiety, which they measured from the GAD-7? And then this idea about human flourishing, they use the flourishing index. This is an idea that's consistent with solution-focused thinking. And basically, they didn't want to just look at symptom reduction of anxiety and depression, but they wanted to say, does their life change in a positive way in any form? And so this flourishing index looks at things like life satisfaction, mental and physical health, meaning and purpose, character and virtue, close social relationships, and financial and material stability. And then finally, they also asked them about SFBT attributes. So this came from the solution-focused brief therapy index, and it measures things like hope, self-perception of strengths, connection to important people, confidence to solve problems, and confidence that their future will be good. So these are the different measures that they looked at as they were looking for changes within this group. In the two groups, you can see here that the participants in the treatment as usual group, they averaged about 40 years old, 40 and a half years old, whereas the solution focus group, they averaged about 35, almost 36 years old. So slight difference there. As far as sex, both groups had small, about 0.25% of men, while they had just about 75 or 80% worth of women. Fairly homogenous groups, 72% in both groups were white. And then you can see an interesting thing here in the treatment as usual group, there was about 21% of people who identified as Black, whereas in the SFBT group, about 22% identified as Hispanic. So that's an interesting kind of flip-flop, but overall, about 3/4 of each group were white. Then we want to look at the results. And the results, here are the statistical results. All of the things that are in bold, depression, anxiety, flourishing, and the SFBT scale that includes those things that I listed there again, also HbA1c and the systolic blood pressure. All of those things had significant differences between the treatment as usual and solution focus group. What that means is depression was significantly lower in the SFBT group. Anxiety was significantly different in the SFBT group. Flourishing was significantly better in the solution focus group. The SFBT constructs were significantly better in the solution focus group. But also surprisingly, the H1C and the systolic blood pressure, those also changed. So there were some physical differences, whereas there was no change necessarily in BMI or in the systolic blood pressure. So it didn't change all of the physical symptoms that they were measuring, but it did change some. Again, I want to point out that this is an important thing because this only took place in 3-week time. So this wasn't a real long duration of intervention that these folks were getting, but it did result in some significant things happening here. So then what does all of this mean? One, the authors pointed out that solution-focused brief therapy had an effect as little as 15 to 30-minute sessions. And really remember, the maximum that sessions that people got was 3 sessions. So this is a maximum of an hour and a half worth of solution-focused interventions, and it's having a significant difference on anxiety, depression, blood pressure, glucose levels. And also SFBT, the implication for that is that SFBT might be a sustainable, efficient, and cost-effective intervention for people dealing with comorbid conditions. In addition, and I think this is an important thing, this was the first study to look at flourishing as a construct within that solution-focused literature. And one of the things that I think that this is really why this is really important is because we don't want to just look at does solution-focused brief therapy reduce symptoms? We want to also look at does it help them move in a worthwhile direction? And flourishing, which is really similar to well-being, in essence says it increases people's well-being. They're happier, they're thriving a bit more. So it's not just reduce symptoms, it's also increase positive symptoms. This study was conducted in a setting that provides medical services. And again, the authors kind of threw this in, but I think it's an important thing that where the clinic was, where these participants generally come from, they tended to have lower socioeconomic status. They tended to have typically more complex comorbid disorders. And again, the reason for that was that they probably don't have access to healthcare, being low SES. And again, then this third thing is they're typically a rural population, which we know in and of itself means they're not getting access to as abundant healthcare as people in urban settings. So what this means is it's not just that solution-focused brief therapy worked, but it worked with a population that typically doesn't get a lot of healthcare. There are a lot of barriers to low SES, to complex comorbid disorders, to rural populations. And so what this is saying is this really short spurt of intervention had a significant difference with a population that has a lot of barriers to getting there. And so these findings, although preliminary, are really significant because it's saying this population doesn't usually improve. And yet we're seeing in a short amount of time they did improve. And so the other thing that I think is important is that they pointed out that there's a limitation where they only did this work for 3 weeks. They only measured at the 3-week mark. And so we don't have a lot of follow-up data about this. Do those changes persist over time? So additional research is needed in this behavioral model to say, does this integrative care model, including solution-focused brief therapy, does it have long-term impacts? I think there's some really important things that are here, but we do need to look a bit farther as well. So all of that, and then here is the official reference that you can find. And again, this is a really recent study. So one of the things that I think is really valuable about this study is that it's looking at a particular population that we don't usually get at. It's looking at a population where they're coming in not necessarily for therapy, but for something else. And then in addition, it's a short-term process. So in essence, what this is saying is people who don't necessarily come looking for mental health services and who might not get it still benefit. And they benefit in a really significant way, and their health will likely improve. So I think these preliminary findings are really, really beneficial, and I think we really need to do more research. But I think that it shows that solution-focused brief therapy can be effective in medical settings and in really short durations. So hopefully that's helpful to you. I'd love to hear what your thoughts are. If you know other research that's looking at these kinds of things, I'd be happy to look at it. But hope this is useful. And I would love to hear your thoughts. So thanks.